Have you ever been diagnosed with multiple other conditions only to be finally diagnosed with Lyme disease? I'd like to discuss this case. I'm Dr. Daniel Cameron. This is part of a common sense Lyme disease case series from my practice. In this case, my patient was diagnosed with multiple medical conditions. Her list included migraines, OCD, chronic fatigue, fibromyalgia, and dysautonomia. She had been hopeful with each diagnosis. She had been treated, but she remained sick. The doctors started raising doubts about her illness, started assuming that she had a psychiatric condition. But finally, she was diagnosed with Lyme disease. She was fortunate enough to have a positive test. When you have a positive test, it certainly helps, but you also need to use clinical judgment. She had relief despite the frustration of having been sick for so long. Treatment started, and she did quite well. The brain fog, the dysautonomia, which was the POTS presentation, even her stomach problems that she thought was constipation and gastroparesis improved. Not everybody gets better with the first therapy, but many of them get better with retreatment. From my experience, the real diagnosis had been Lyme disease all along, and so in her case, she didn't give up. I encourage people to at least keep Lyme disease under consideration, along with other doctors who are trying other diagnoses to avoid having diagnostic delays and to avoid having to have complicated treatment strategies. This is part of a common sense Lyme series with you. Please leave any comments or questions below, and I'll do the best I can to answer or address those questions. And thank you for joining me.